It's time for our nursing tip of the week, and in this week's tip, we are talking about PEEP valves. Before the select few of you guys come at me saying, you're not an RT, you're an ICU nurse, why are you talking about this? Don't get me started. I think it's super important for ICU nurses to have a level of knowledge about RT equipment and the ventilator and all things like that, because you know what? At my hospital, RTs have so many patients, and there are times where I call an RT for help and they are 2, 3, 4, 5 minutes out. I need to know exactly how to work stuff. And a PEEP valve is one of those things. So what is a PEEP valve? A PEEP valve is exactly what it sounds like. It controls PEEP. When your patient is hooked up to a ventilator, you can easily control PEEP on the ventilator by pushing a button. But if you were to disconnect a patient from the ventilator and hook them up to an ambu bag, they no longer have that same PEEP. So the PEEP valve hooks up to an ambu bag and allows you to adjust the amount of PEEP that is being administered to that patient. This is super important because if you have a patient that's on 100% FiO2, PEEP of 15, now they're sitting down in the 70s and you need to manually bag them, you do not want to bag that patient without a PEEP valve because now you are de-recruiting all of that alveoli. There's a couple different types of PEEP valves. Most of them are disposable, and typically you can adjust it by twisting this little red portion up right there. We're actually required at my hospital to just have a PEEP valve with every ambu bag on every vented patient, because it's one of those things when you need it, and you don't want to be running trying to look for it. And that's your tip of the week. Let me know if you have any questions.